On today's World Insight, an Omicron-fueled resurgence of a prolonged pandemic. What's the prognosis and what's the exit strategy?
Hello, I'm Tian Wei, and this is World Insight. Confirmed COVID cases worldwide have surpassed the 470 million, with over 6 million deaths. The latest data from Johns Hopkins University shows. From December last year, reported weekly cases topped 10 million for 11 consecutive weeks. Starting this month, China has also battled an upswing in cases across 28 provinces and regions. Chinese mainland reported nearly 2,600 new cases on Tuesday alone. WHO's COVID technical leaders said there was too much misinformation, which led to the spike in cases worldwide. The WHO warned against the danger of assuming the pandemic is over and that there will be no more deadly variants to deal with. The global COVID resurgence could herald a much bigger problem as some countries drop testing altogether. The Omicron-dominated outbreak is seen to be a long, tough battle. For deeper insights, let's loop in our panelists. More on the latest about the COVID-19, we are joined in Seoul, Dr. Alice Kim Kyung-tan, internist at Ms. Medi Women's Hospital. In Lancaster, Dr. Mohammed Mumir, who is a virologist and lecturer in biomedicine, health and medicine with Lancaster University. In Nanjing, Wu Zhiwei, director of the Center for Public Health Research with the Medical School of Nanjing University. Ladies and gentlemen, what a pleasure to see you. We are at a critical juncture, one could say, because different countries are now facing with very different situations of COVID-19 and taking very different approaches for their own situation. Tell me more about what is the general situation in where you are. Let's start from Professor Wu Zhiwei in China.
Recently, we have seen flare-ups all over the country in about 24 different provinces and municipalities. We see a limited surge in number of new cases. Most of those cases are Omicron and its subvariants BA2. And you can see that there are some characteristics with this new upsurge in COVID-19 cases. First is that there are a lot more symptomatic infection as well. Overall, it's a very rapid development.
China has been seeing about 12,000 new cases over the past few days. That's almost unprecedented since the start of the pandemic worldwide. Let me also ask you, Dr. Alice Kim Kyung-tan in Seoul, what's going on in South Korea?
Well, we are in the midst of the worst wave since the start of the pandemic here in Korea, also due to the Omicron variant. Just to give you some perspective, the Omicron variant became the dominant strain January 14th. At that time, we had about 680,000 cumulative cases. In the short period of about 2 months, a little over 2 months, we've added 8.9 million cases. But also very concerning is the rise in deaths that we've been seeing. Unfortunately, we logged about 4,700 deaths in the first 3 weeks of March alone. Any talk of Omicron being mild or Omicron being like influenza really does not apply to our country at this moment. Because when we compare the number of deaths due to Omicron compared to, say, a typical year of the flu, I'd say we have about 5,300 deaths annually on average across all ages due to influenza. So there is really no comparison. And that's why, as I've been saying since the very, very beginning, of the Omicron wave, we need to stay careful. We can't minimize this disease. The impacts can be huge.
All right. Dr. Munir, your thoughts on what's going on where you are in the UK?
Well, in the UK, around 3 weeks before, we have lifted all those control measures, those being put in place. And since then, the number of cases are rocketing high. And now that is compounded by the BA2 subvariant of Omicron. Not only the infections are increasing rapidly, but also hospital admission are also increasing according to the same rate, which is relatively unique because before in the previous waves, we have seen that hospitalization usually lag around 3 to 4 weeks behind the infections. But now the hospital admission and deaths are increasing proportionally as the number of cases increasing. That indicates that people are going into the hospital because of COVID, not with COVID. And that is really something different in this 7th wave of COVID.
Every country certainly has very different approaches. Can you help us to understand why your country taken the approach that is taken right now? Let me start by talking to Professor Wu. China is still going with what China calls dynamic zero policy.
Well, the dynamic zero policy basically comes from the early days when we're dealing with the COVID-19. So this policy has been very effective in controlling the infection. Once we have an Omicron, what we have seen is that it's getting less and less effective because the Omicron is so contagious and transmitted so effectively and also because of so many asymptomatic infections. In a new wave of the surge, we realize that time is very essential because in a number of different provinces and municipalities, we realize that once we take the traditional nucleic acid test and takes 24 hours, it could be too late. So that's why the government introduced, first established more nucleic testing stations. When antigen testing in the individual hands, the question is how you are going to report it, because nucleic acid test is integrated into the entire public health reporting system. Once we have a positive case, then the information will quickly disseminate into the authority, and then you can take certain measure to do either quarantine, to do screening, and the contact tracing. So we need an entire new infrastructure to back it up to be effective.
Right. Dr. Tan, to South Korea, there were earlier stages of similar to China's approaches. Then South Korea has taken a different approach. And at times it was a little bit cautious, holding back, and now it's going one step forward. Yet you see numbers are skyrocketing. Tell me more about how South Koreans have been articulating the approach that they have been doing right now.
Well, first of all, we recognized that we needed to protect our most vulnerable groups through vaccination. And so we had a very aggressive vaccination campaign, especially in seniors aged 60 and above. The vaccination rate for third doses is 89% in that population, so quite high. However, and I think this is a warning to other countries that are not yet experienced Omicron, is that even after receiving 2 or 3 doses of COVID-19 vaccine, our elders, some of them seemingly do not form the kind of immunity that they need to fight off the virus. The mortality data say over a 5-week period when the Omicron was dominant, so that was the 2nd week of February to the 2nd week of March. What we noticed was, of course, 94% of all the deaths occurred in the elderly population, but 52% of people who are 60 and above who ended up dying had actually received 2 or 3 doses of a COVID-19 vaccine. And so this really speaks to the need of, we need better vaccines. There's still people, even though we think they're fully vaccinated, they're not fully immune. And also Omicron is so transmissible. Once it started to infiltrate into the long-term care facilities, the nursing homes, convalescent hospitals, it caused huge outbreaks. In the last month alone, 16 of these long-term care facilities had been infected, and per facility, it caused anywhere from 100 to 300 cases. And of course, many of these cases ended up with severe disease. When we look at the overall population, however, the case fatality ratio after 3 doses of a COVID-19 vaccine is 0.05. So very, very low. And so because we have that piece of data, we can't really justify having very strict social distancing and public health measures in place. And so we are in a transitional state. I think we have passed the peak of this Omicron wave. We are hopefully on our way down, but it has had very severe impact and consequences in its wake.
Thank you for your explanation. It gives a lot of real information and also background about why South Korea has been taking up the approach it is today. It really, the devils are in the details, as in every case in any country. Dr. Munir, going to the UK, of course, the UK has been suffering from the very beginning, the huge number, and over the time there were ups and downs, and now it seems that apparently everything going back to normal, celebrations in the streets. How do you see the British have been articulating the kind of approach that you're adopting today?
I think like any other countries, UK strategy for controlling the COVID pandemic has been in the evolutionary state. And at the moment, vast majority of our emphasis has really been onto the vaccine. So we are very much dependent onto the vaccine approach. And as you know, one of the first countries approved the vaccine. And since then, we have very exhaustive, very widely open vaccine campaigns from all ages. However, what happened is that down the line, when we had around 80% of the population being boosted with the 3rd dose, the immunity started waning, and that is the thing that we haven't realized. And until the BA2 came in, when we realized that BA2 is not respecting the immunity, as my previous speaker been saying. So, and now at this stage, what we are realizing is that the immunity is waning, and therefore there is a need for the 4th dose. Government announced that there would be a booster, which would be the 4th dose. A second booster will be offered to 75 years and older, or people who are immunocompromised, starting from this Friday, and around 5 million people are eligible for this 4th dose. And the whole plan for this one is to boost up the immunity, so that whatever the immunity is provided by that vaccine, it top up the protection against the BA2 variant, which is around 1.4 times more transmissible than the BA1 variant, and that is what is whipping through the society.
There are several things I want to ask you, because there has been so much misinformation, miscalculation, and miscommunication, shall we say, in terms of what is the nature of what we are going through right now. Of course, different countries different, but for example, is it really like the flu? Let me also ask Dr. Munir, do you think it is going to be eventually like the flu? Are we closing to that stage?
Well, it would eventually might end up like a flu endemic virus, but at this moment, it is not the case, and it never been the case since the start of this pandemic. Because if you look on to all those 7 waves, although there is a period, there is a frequency, there is a rhythm between all those waves. Some are associated with the seasonality, and some are associated with the control measures that have been put in place. But none of that wave has ever been equivalent to the flu impact onto the society. And even if we look onto the biology of these 2 viruses, SARS is completely different virus than is the flu. It's from genomics to the biology, how the virus replicates, all these are different. So at this moment, I think we are nowhere closer to the state where we can call the SARS-2 as an endemic, or will be closer to the flu.
Professor Wu, your thoughts? Is it going to be like the flu? Is China experiencing something that is almost close to what China would experience about the flu? Do you think this is misinformation, or this is something closer to reality?
Well, I would agree with Dr. Menia's point that eventually this COVID-19 probably will be like a flu. But right now, we do only have a very limited information on its biology and its mutation as well. And also, particularly in the clinical pathology, we still do not have sufficient information in the long-term effect on humans once you contract the virus. And we're still learning how this virus would do to your bodies. So it will take some time to get a true picture on how the virus, whether it's like flu or whether it's a completely different virus. But based on the virus evolution, it seems to be it's getting more and more like flu. Recently, I have been reviewing an article on the virus how they can recombine and mutate and becoming a new virus. It has a lot of similar characteristics as a flu. The virus is highly mutable to adapt to the environment. So this is something actually we should bear in mind that we're dealing with a virus which actually we only know for about 3 years. So it will take time before we get come down to a conclusion.
Are we going to see herd immunity very soon? But if there were herd immunity, is a herd immunity about what? About COVID-19 as a whole, or about only one variant?
Well, we can expect that the herd immunity could only be achieved against the viruses that are stable. You can imagine the herd immunity means that a fair proportion of people in a community are having resistance against the virus. But here are two questions. First, that the immunity that is raised by vaccines or by natural infection is very short-lived. So we have only 3 to 4 months a good level of protection, even in a vast majority of the people who are vaccinated, which means that over the time, the immunity goes down and people are staying again vulnerable to the infection. The second aspect is that the virus is mutating. So even if the immunity is sustained, the virus mutate and new variants would come. For instance, the recombination that been highlighted before is becoming very normal now. I mean, first we thought that that is not really one of the phenomenon, but now many countries, included many in Europe, in the United States and in Australia, all they are reporting the recombinant, which in other words, Deltacron, which is a combination of Omicron and Delta variant. So when new variants would come in, the existing immunity into the population, which we call herd immunity, might not be sustainable. And that is what we have seen so far. And that is the reason vast majority of countries are now thinking about moving to the fourth jab to just keep up that immunity. So considering these factors, both virological, biological, and behavioral things, I don't think herd immunity is likely to be achieved in near future. And also one thing I would like to highlight is that herd immunity, when we talk about, we don't talk about in a country level, we talk about at a global level. Right. And now the vaccine equity has been one of the major issues. And just to recall on the fact that most of the variants that have emerged, those have emerged from unvaccinated population. Alpha variant started in the UK when vast majority of people are not vaccinated. Delta started in India when large people of the country were not vaccinated. Omicron started in South Africa when vast majority of people were not vaccinated. Every nation that is not vaccinated will have a likelihood of raising more and more variants. And when those come into a global scale with the globalization, I think herd immunity is probably too naive to think about it.
I see. Dr. Tan, also your thought about the quote-unquote herd immunity.
I agree with our previous speakers. In terms of endemicity, that is only one possibility. The other possibilities, as mentioned, is the emergence of recombinant virus. And this is actually very likely to happen. This is not science fiction. This is fact. This is what has happened in the past and what is likely to happen in the future. But there are also other possibilities, possibilities that happen with other coronaviruses, in which there's something called organ tropism, and there can be a change in terms of right now the SARS-CoV-2 virus tends to go into the respiratory tract. It could also affect the blood vessels. But the virus could change in terms of its preference for which cells it prefers in the body, in which case we would have different symptoms and perhaps different disease manifestations altogether. And it can go both ways. It could either go to sort of a lighter form of COVID, or it could become a much more severe disease. I mean, this is something that's possible that we can think about. And also, there's also the possibility of something called antibody dependent enhancement, in which case what happens is you have immunity either through natural infection or through vaccination. But then when you're reinfected with the virus the second time around, the second round can be actually much more severe than the first round. Right. This is also a phenomenon that could happen. It happens with other viruses, as for example with dengue, and so experts have brought up these possibilities. Nobody likes to hear about them because they're bad news, but it is something that we need to consider and we need to have a plan for.
Now, there has been a lot of talk almost in every country about a combination of vaccines, about protective measures, as well as anti-COVID pills. Now, the pills have been developed by different companies, different research groups. One pill's effect could be very different from another. Now, how do you see these combinations of things?
Well, here in South Korea, we have Paxlovid, which is the antiviral pill manufactured by Pfizer. Yeah. And our early experience with this medication has actually been very positive. The problem has been having widespread deployment of this medication. And I think there is first hesitancy on the part of the patients to take this brand new medication. There's also hesitancy on the part of physicians to prescribe this brand new medication because they don't have experience with it before. And then of course there are some drug-drug interactions and contraindications for this medication that make it a little bit tricky to prescribe. Right. But I think if we had a higher uptake of this medicine in our high-risk groups, especially, our mortality rates would actually go down much more. And so this is something that we're working on. Later, we will have doses of molnupiravir, which is another antiviral pill. It actually decreases transmission significantly, even after the first 1 or 2 days of taking the pill, which would be such a significant help because, of course, with Omicron, that's the problem, right? Yeah. People are spreading the virus very quickly without even knowing that they are spreading it. And so if we can decrease transmission effectively, that would help tremendously.
But we cannot guarantee, can we, Dr. Munir, that antiviral drugs that are helping us today with the latest variant would help us later with other new variants if they come. Dr. Munir?
Yeah, absolutely. I think as Dr. Alice was mentioning, I mean, these are really good news. However, there is one phenomenon that is true and has been demonstrated before is antiviral resistance. For instance, if we talk about Tamiflu, which is one of the drugs we use against influenza, if we talk about remdesivir, if we talk about ribavirin, all those drugs are inducing resistance within the viruses. And over the time when the new variants come in, or extensive use of this would make these, render these antiviral or antibodies, which are cocktails, become resistant. And because of this resistance, the overall scenario need to be visited continuously, particularly when new variants are coming in, whether those antibodies that are being used or antiviral, those have been developed, are good enough. So this is a kind of living analysis and real-time analysis that need to be carried out.
In China, of course, the cases were really low earlier, almost for past 1.5 years. And now with uptick in the cases, even though a gigantic number compared to China's earlier record, yet compared to the others, it's not necessarily that significant, yet it's already putting huge pressure on the society given China's dynamic zero approach. So how do you see the combination that the other two doctors have been talking about?
Just a couple of days ago, Chinese authority authorized the use of Paxlovid in China. Yeah. So basically what we're thinking is that we have a two-pronged approach in containing the virus. One is the vaccine plus the public health intervention measures. So this actually has been very effective in China. You can see that so far we only have 21,000 confirmed cases, and among this number, we only have 39 severe cases and 2 deaths, which is extremely low. The issue is that how long this will go on. As we just across the country, we see there is different provinces, they actually set up very drastic measures in containing the virus, which inevitably will disrupt the social and economical activities. So once you have the Paxlovid like drug in China, in the Chinese market, in the clinic, then basically when people are getting really sick, then you have a way to treat them. I think this will give a certain kind of assurance to people who actually might be becoming infected and becoming in a severe situation. I think if that is the case, this is something we need to think in the way how we deal with the virus, whether we should adjust our policy on the dynamic zero clearance. Maybe that we can take a stepwise approach, that particularly aiming at those highly vulnerable people, like elderly people who actually are highly susceptible to the virus and develop severe diseases.
Tell me more, just briefly, about what do you think this evolutionary stage need to be taken into account of? Let's go with Dr. Tan first.
The priority always is to decrease deaths and disability due to the disease. But we also have to be very cognizant of the impact that it has on economies, on schools, on normal life. And so the most important aspect right now, I think, is trying to find a balance, a tolerable balance. And I would like to mention that, China was very successful in using the closed loop approach in the Olympics. And it's something that perhaps you can consider, or we can consider in the future for people living in long-term care facilities who are the most vulnerable, having something like a closed loop approach for these facilities.
Let's also go to you, Dr. Munir.
Well, I think moving forward, one thing is true is that we need to develop novel vaccines that is based on the current variants, and also to deploy the way that is being unconventional. For instance, microneedle patches or nasal spray or other means of administering the vaccines, because even if we would manage to control the disease in the long term in a developing nation are still struggling to deploy the vaccine. So until we don't have that level of deployment, is going to be a challenge. And secondly, I would just wanted to add, although we've been discussing this one earlier as well, is that vaccine only is not really the approach. I think we have learned in 2.5 years that vaccine alone is insufficient. We have to keep applying other measures in conjunction with the vaccines to really safeguard the public and to avoid further deaths and disabilities.
Thank you. And Professor Wu.
Well, the virus is evolving. Our public health approach should also evolving as well. The virus we know today is very different from the virus we knew 2 years ago. So that's why we need to find a new way to deal with the virus. Basically, it's what I call it, the cost and the benefit approach. We have to take that into consideration to do a much better job, and I think we can.
And that's all the time we have for today. If you'd like to know more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of my team, thanks for being with us. Bye for now.